we are going to go ahead and get started with your examination this evening. So thank you very much for coming in. And the first thing I'm going to do, of course, is just have a look at your back and a look at your skin. So, excuse me while I just get Penlight. So I have a couple different lights that I'll be using. Okay. So I'm going to start off with just a basic Penlight, and it's going to help me kind of gauge the overall state of your skin, look for any problem areas, that kind of thing, okay? So what I'm going to do first, if it's all right with you, is just move your hair. And of course, before we begin with the examination, I do want to inform you that my hands are clean. I will not be wearing gloves as this is not an invasive exam. It's more so topical. I will be touching your skin, touching your hair, using various tools on you and that kind of thing, okay? So I just want to make sure that I have your consent for that before we proceed. Okay, thank you very much. So I'm just going to sweep your hair out of the way for a second so that I can better visualize the entire area here. So just moving your hair so that I can have a look. Okay. Okay, so I'm going to start up at the top, and using my light, I'm just going to kind of graze over, have a look at different areas of your back. So around your shoulders, I am noticing a bit of freckling here. So it appears you might have just a little bit of excess sun exposure there, so it's okay. Moving on, having a look at this top quadrant here, I do notice a couple kind of wayward freckles. It does appear as you had a little mole removal done there. Again, I see another mole here. It does appear that there's actually two here, so we'll take note of that and have a look at those in just a bit. Now, coming around to the middle of your back, taking note of your tattoos. I'm just looking at the skin around the tattoo. Now, is this a tattoo that you've had for a while? Okay, so it's healed nicely. That's a good sign. No sign of infection, and it does appear to have settled, so I would guess you'd had it for a couple of years at least. Okay. Okay, so I do note another freckle here, as well as what appears to be a mole here at the center of your back. Now this one is a little bit elevated. I wouldn't say it's abnormal in color, but I definitely do want to come back and have a look at that one, okay? And then you do have a more obvious mole here in the center of your back. And this one is what I would say is normal in color and shape. So it's circular, not perfectly symmetrical, but I'm not seeing any abnormal edges or anything that could be concerning there. But again, we will have a closer look. And now moving down your back, having a look at the lower half. So kind of this section here. I am seeing less blemish, so this appears very clear. There are no freckles here, likely because this is not an area that's frequently exposed to the sun. Now I do see one more mole here and a couple extra freckles on that left side. But overall, I would say your skin is very healthy. So I'm not noticing any blemishes, often referred to as bacne or back acne. So it doesn't appear that you're producing any excess oil, which is good. Skin is very clear. I'm not noticing any active breakouts. Also not noticing any older breakouts, such as comedone or anything that could be impacted underneath the surface of the skin. Okay. So just having a look. have a look at this tattoo here, okay? And I'm just gonna peek a little bit. Just having a look at your tattoo. So again, it does appear to have healed quite nicely. I'm not noticing anything too concerning here. I will have a look though with my other light if that's okay with you. Okay. Okay. Alright, Isabelle, so let's go ahead and have a look with our other light. So this one kind of looks like a flashlight. Just gives off a little bit of a different color, which allows me to look at those moles a bit better, okay? Okay. Alright, so why don't we start with the one closest to me. So I'm just going to come around here and shine this light. Okay. Okay, so it doesn't appear to be anything concerning. You do actually have two moles here. Fairly oval shaped. Nothing that I would say is a concern there. Now they are normal in color, which is one of the biggest indications that we look for. So no blackening, no kind of spotted color there. It's all solid brown, almost like a flesh tone color. Okay, and slightly raised from the surface of the skin, but again, nothing that I would say is acutely abnormal. So I would say that those ones are okay. Okay. Alright, so having a look here, and let's go ahead and look at this one that's in the middle of your back. And this one might be something that we should keep a closer eye on. So it is quite elevated from the surface of the skin there. Margins, I would say, are within normal limits. Color, again, is that kind of flesh tone. The texture, I would say, is what's just a tad concerning to me. So I do think that we should go ahead and document that and then just keep an eye on it, okay? I might even refer you out to a dermatologist. They can have a little bit of a closer look. Okay. Alrighty, so moving down to this one here. And this one is completely flat. What is slightly concerning to me is that it does have a little bit of asymmetry along the edges here on the right side. Not quite as circular as I would like to see, okay? Again, something that I do think that we should keep an eye on. And then this little guy here looks okay. I don't think this one is anything that we need to worry about. Okay. And of course on that other side, nothing too remarkable there. Okay. Isabelle, while I have this light out, I'm going to have a look at your tattoos just a little bit closer, okay? Okay. So just coming in a little closer here, I'm going to have a look. Shining my light so I can just see. This one does appear to have healed quite nicely. So just noting where the ink has settled along the edges here, looking for any signs that your skin could be irritated. Now, because they are older tattoos, it's not something I'm extremely concerned with, but I do just want to go ahead and have a look. So I'm just going to stretch the skin here just slightly so that I can have a little bit of a better look. Yeah, I think that's okay. Okay, alright. Okay, Isabelle, so we can go ahead and move on. And Next thing I'm going to do is have a listen with my stethoscope, okay? So essentially this tool is just going to allow me to have a bit of a better listen to your heart as well as to your lungs. So mainly what I'm listening to now is your lungs. And I'm just going to place this in my ears and ask you to sit fairly still for me. Okay. I will say this is a little cold, okay? So just try to remain still for me. It's only take a second. So I'm just going to start up here and just normal shallow breaths. So far, all of this is sounding normal. Not hearing anything that would be concerning just yet. Just making sure to listen to the different quadrants. I don't want to miss anything, but not noticing anything just yet. And I am going to listen bilaterally. That just means that I'm going to listen on both sides at the same time. So listening on this side and then on the other. I'm going to do that on 3 different sections of your back. Good. Okay. Very healthy lung sounds. Heart sounds good as well. So I'm going to have a little bit of a better listen to your heart, okay? Good. Okay. Bowel sounds good. Bowel is active, which is a good sign. You're digesting your food properly. Okay. So what I'm going to do now is just get a different tool here. And this tool is called a Reflex hammer. And essentially I'm going to use this to percuss your lungs while I listen with my stethoscope, okay? So just remain still for me. I'm just going to place this on your back and do a very light tapping, okay? Doing great. Good. Okay. So now I'm going to do that down your spine, okay? Good. Good. Okay. I'm just going to listen with the bell side, okay? Okay, good. Okay. All right, Isabel, so all of that sounded really good, okay? Perfect, okay. So why don't we go ahead and move on, and I think the next thing I want to do is take a couple measurements for you, okay? So just going to measure a couple different areas of your back. Now, starting with this first roller, I'm going to go ahead and measure those moles, just so that we can get a bit of an indication of where they are now, and then we can record them as well on your next visit, okay? Okay. So just going to mark here. So say that's about 1.5 centimeters. By about 2. Okay. So fairly small there. And then this one I would say closer to the 3 to 4 mark. Okay, so 3 to 4 mark. Right, now I'm just going to measure the height, which is about a 1.5. So it is slightly in the abnormal range, okay? Yeah. So I don't want to concern you. Let's not worry about it just yet. I will go ahead and get you the referral to that dermatologist so they can have a little bit of a better look. Might even end up doing a biopsy there, okay? Okay. All right, dear, so let's keep going. I'm going to start with this one here. And this one is a little larger in size, so we're at about... So I'll say this one's at about a 5 centimeters there. And 5 by 4. Now that is completely flat there. This one. Okay. Alright, so I'm going to do this one now. Again, fairly small. This one's in about the 1 by 2 range, which is okay. Okay, so we'll call that one 2 by 2, and then it's flat as well. Okay. Okay, you're doing so well. We are moving right along. I'm going to use this tool here to kind of have a look at the height of this one in the middle. So just to give you an example, when I kind of follow this along an area of your back that is rather smooth, I don't need any resistance. And you have a mole here that is very flat. So even when I smooth over this one, I can feel it just slightly. But nothing that I would say is significant. Now, this one at the top definitely is but I would say a little concerning here. So this is definitely one that I think we should take note of. Okay. All right, so just making sure. All right, dear. So let's go ahead and move on and using this ruler now. And this tool is going to allow me to measure the curvature of different areas of your back, okay? So what I'm going to do is start up at the top and just using the pre-lined arc here, and I'm going to use that to measure your scapula. So natural indentation of the scapula here is notable, which is good. And we are within normal margins there. So what that means is the areas that are not touching are well indicated here. We have healthy scapula gap there, which is great. Okay. So testing that on the other side as well again. Notable indentation there. And again, well within normal margins on this side. Perfect. Okay. And then if we measure the midline there, and we are right about even, maybe just the off center, just a touch there. Definitely well within normal limits, okay? Okay. Now coming down to measure your spine. Good, very good margin there. And lower back as well, we do have a very healthy range here. Now if I measure horizontally, and we are just about midline there as well, so that is great. Okay, very good. Okay, so let's go ahead and move on to our last set of measurements. And for this portion of the examination, I'm going to go in with my calipers. This is just a tool that I'll be using to measure for symmetry. So measuring whether one side of your body is fairly symmetrical in comparison to the other side. So whereas asymmetry would mean that perhaps your left side is slightly offset from your right side, or perhaps one of your limbs is longer than the other, that would indicate asymmetry. So when it comes to your back and your spine, essentially just looking to see if there's any atrophy or any wasting of the musculature from one side to the other, okay? Okay. All right. Also checking for scoliosis, which doesn't appear to be apparent here, but I do just want to go ahead and have a look there, okay? Alrighty, so this is very cold, I'm sorry, but I'm going to go ahead and check. So let's start by checking your shoulder. So I'm going to do from about the top ridge there to just below the axillary area here. So that's good. Okay, and then measuring distance here again, slightly off, but nothing that I would consider concerning there. So where I do see a slight misalignment, I would say your right scapula is just slightly lower. Could also just mean that you're due for a good stretch, possibly a visit from a chiropractor, but I don't think that there's anything concerning. It doesn't appear that this shoulder is dislocated, so that is okay. So moving on to the mid portion of your back. Okay. And then bringing that in just a little bit. And then I'm going to compare as we bring that up. And that as well as comparing the individual sections there. I'm going to go ahead and come around on the other side, okay? Okay, so let's have a look on this side as well. Okay, so that looks okay to me. Very good. Okay, so I think we're okay there. Okay, so coming back over, let's go ahead and move on, and let's see. I think what I want to do now is have a look here and just going to have a very brief look at your scalp. Now, nothing too in-depth here. I just want to have a brief look at a couple different areas, okay? So I'm going to start by coming up to the top and just shining my light directly on your scalp where your part is already done here. And I just want to have a look and see if I notice anything. Any signs of discoloration, any signs of infestation, any possible lice or ticks or anything of that nature, which I am not noting. And you've also not been experiencing any symptoms that would correspond with that, correct? No itchiness, flaking, dryness. Okay. Very good. So all of that looks okay. Now, just going to slightly agitate this area. So just using my brush here to make sure that I'm not noting anything. Having a look at the hair texture, hair integrity, having a look at the ends of the hair, which tend to be more vulnerable, and Not noting anything here. Just gently parting the hair, having a look at the back. Again, not noting anything abnormal. Hair texture and color is in line with age and ethnicity. It does appear that your hair is color treated, but given that it's been processed with bleach, it does appear to be fairly healthy. Not noting any excess dryness, which is always a good sign. Okay, now if I just perform a couple tests here, I'd like you to just briefly indicate whether or not you feel this stimuli, okay? So this portion of your examination is going to be very brief as far as your scalp is pertained. So I just want you to let me know whether or not you can feel this. So you're either going to feel pressure or cold. And they are very distinct, okay? So pressure or cold, and you just indicate which you feel. Okay. So let's start with just a bit of a test here. So can you tell me if this is pressure or cold? Cold, good. And pressure or cold? Pressure, very good. Okay. And here, pressure or cold? Cold. Pressure or cold? Pressure, good. Pressure or cold? Pressure. Pressure, very good. Cold, good. Pressure or cold? Pressure or cold? Cold. Very good. Pressure. Okay. Alright, dear. So all of that looks okay. Let me just have a look at the hair itself for just a second. So I'm just going to set my tools here if that's alright with you. And I want to just have a brief look at your hair, mainly at the hair shaft. So I'm just going to section off a small little section here. Okay, so having a look at the hair shaft, just going to kind of fan out the edges a little bit. Okay, so that looks okay. See just a little bit of breakage here, but nothing that I would say indicates that your hair is unhealthy, so that's a really good sign. Does appear well hydrated. Okay. So I'm going to do just a little bit of a strength test here. So I'm just going to hold the mid shaft and tug gently but firmly on the ends. And just making sure that there are no signs of excess breakage here or any signs of abnormal elasticity where the hair becomes almost like a gummy texture. And I'm certainly not noting that here, which is great. Okay. Alright, and the skin on this side looks good as well. Okay. Alright, dear, so I'm going to go ahead and come back around on the other side. And we can go ahead and move on. holes here, and okay, so we are almost done with your examination, Isabelle. You are doing so incredibly well. So the next thing you want to do is just test your skin texture once more. So I'm going to very briefly slide this down the length of your back. Okay, so this is just a wooden tongue depressor, unused of course. And I'm just going to use it to run along the length of your back. Now I do apologize, this can be a little ticklish. I do just want to make sure that there's nothing abnormal that I've missed within your skin's texture and the barrier of your skin, okay? So I'm just going to start here. So essentially, I'm just seeing if there are any abnormal lumps or bumps that I've missed. And because the surface of this is very flat, it allows me to very easily tell if there's something lying underneath the surface of the skin that I might not have noticed. So just applying a gentle pressure, enough to slightly indent the skin, just enough to see if I've missed anything, and I don't believe I have. Okay, all of that looks great. Okay. Alright, so moving on. Once again, assessing skin integrity. This time I'm checking for your skin elasticity. Now you are very young, so I'm not expecting to see a lot of excess skin, especially not on your back, because there are some fat deposits, but not as much as you'd see as far as loose skin on your arms or on your face or on your chest. So I'm just going to be using this pair of elongated tweezers to gently tug at the skin. Now testing skin turgor and integrity, just very, very gently pinching, should not cause you any pain. Essentially just testing to see how much, if any, skin is able to kind of be grasped by the tweezers, okay? So just very gently pinching here. And I'm not seeing anything, which is a good sign, so healthy indication that your skin is well intact, well hydrated, no signs of dehydration, and very age appropriate, which is what we would like to see. Okay, so all of that is great. Now the last thing I'm going to do as far as today's examination is perform a very brief test of your sensory function, okay? So this is just going to take a couple seconds. I'm just going to test to see whether or not you're able to feel things normally, just as I did on your scalp. So what I'm going to do is touch you with two different objects. Now Now for the first test, I'd like you to just indicate whether or not you feel it, okay? So just say yes if you feel it. If you don't feel it, I will ask you to confirm and then we can kind of go from there, okay? So just to give you a heads up, this is very cold. It is a metal object, okay? I'm going to start here. Can you feel it? Okay. Good. Very good. Very good. I know it's very cold. Good. Yes, very good. Yes, okay. Now I'm going to try that with a different object, also cold. This time it's a very smooth glass, okay? So again, just yes if you feel it. Good. Very good. Very good. Okay. Alright, you are doing really well. We are just about done. So I'm just going to alternate here. And this time I'd like you to indicate whether or not you feel sharp or dull. Now to give you an example, this is dull. And this object is very, very sharp. Now it's not going to cause you any pain, but it is going to elicit a very specific response, and I will use it just briefly, okay? So can you feel that this is sharp? Okay. So I'd like you to just indicate whether or not you feel sharp or dull. Okay. Sharp, good. Dull. Dull. Sharp, very good. Dull. Dull, good. Sharp. Sharp or dull? Dull. Sharp or dull? Sharp, very good. Sharp or dull? Sharp, good job. And sharp or dull? Good. Sharp or dull? Sure, I can do it again. Sharp or dull? Both, very good. It's a little tricky, but you did it. Good job. Okay. And lastly, can you tell me if this is sharp or dull? Dull. Very good. Okay. Alright, so what I'm going to do is just do a brief test for neurological response. So what I'm going to do is glide this tool down different portions of your back where your sensory perception is heightened. And you don't have to answer whether or not you feel it. I'm just looking for a very specific reaction in your musculature, essentially, okay? Okay. Might be just a little uncomfortable, slightly ticklish. Okay. Alright, so starting here. Good. Very good. So that twitching is what I'm looking for. So you're doing very well. Good job. Okay, so going on the other side. Good job. Okay. Very good. Very good. Good job. Okay, I know it's a little ticklish. You're doing great. One more time horizontally. Perfect, perfect response. Okay. So one more time with that with the cold, okay? So just good, very good reaction. you feel vibration here? Very good. Feel vibration here? Good. Very good. Feel it here? Good. Just tell me when that vibration stops. Feel it here? Good. Tell me when it stops. Good. Again, tell me when it stops. And lastly, perfect. Okay. All right, Isabelle. So we have concluded your back examination today. And the only thing I found that was slightly remarkable is this abnormal mole here. So what I'm going to do is go ahead and get you a referral to our in-house dermatologist. So you can make an appointment with her and then she can have a bit of a closer look, get you likely done with the biopsy. That way we can go ahead and test to make sure that there's nothing there that would be a cause for concern, okay? Okay. All right. All right, dear. Well, you are free to go. Thank you so much for coming in for your visit this evening. I appreciate your time as always. I will give you a couple minutes to get dressed, and if you'd like, you can pick that referral up at the front desk with the receptionist, okay? Okay. All right, well, thank you very much, Isabelle. Get home safely.